Can your teeth or your bite affect your posture? What if I told you it not only could, but it probably already has? Let's throw 2 minutes on the clock for the answer and the explanation. Consider this, between the ages of 4 and 12, your face grows the most. And because of environmental and dietary changes in our society, your face may not have grown in the same direction or to its fullest potential that it once would have. May not? Probably should have said have not. As 85% of us, according to 3 different studies, have a deficiently sized midface. And that's point 1, our midface is too small. So when the face develops without the proper forces, the upper jaw begins to drift down and backwards. We call it maxillary drift. And when the maxilla begins to drift down in this direction, so too does the lower jaw, as it normally wants to stay opposed to your upper so your teeth come together. And what's that look like? Well, most of us tend to have a gummier smile and a weaker chin. And a secondary effect of the change in the upper jaw and lower jaw is that the tongue also ends up further back. You see, the size of the cage that it normally would have, it didn't get. So the tongue typically ends up further back and in your airway, making the airway much smaller than originally designed to be. Can you say sleep apnea? Now, here's where your posture comes in. If your face is a little smaller, and so too is your airway, you have to do something to compensate in order to breathe. An easy fix is this. Just tilt your chin up and lean forward, and that'll open your airway. The problem is, your posture, it's not so good now. And it looks like this. Your head is actually tilted up, like you're looking at the ceiling, although your eyes are horizontal. And you'll see this around everywhere. And the smaller the midface and the airway, the more the head has to be tilted in order to open the airway. You remember CPR class? Do you remember how they teach you to open the patient's airway? That's right, tilt their chin up. Sure, you can have braces to fix the crowding of your teeth, which is just another outcome of midface deficiency, but you didn't do anything for your airway, your posture, your facial balance, and many of the other symptoms related to midface deficiencies. So there you go. Smaller faces equal smaller airways, and that results in much poorer posture. So what exactly is all the fuss about poor posture? Well, you may not know this, but poor posture has been related to all of these things. Are you ready? Headaches, migraines, dizziness, vertigo, TMJ issues, shoulder and rotator cuff problems, chronic cough, upper back pain, lower back pain, sciatica, neck pain, degenerative disc disease, acid reflux, sleep apnea, carpal tunnel syndrome, chronic fatigue, and vision problems. Whoa. So let me remind you that simple braces don't fix faces. Explore more and get more here at Breathe Modern Dentistry. If you'd like, we can help you look and tackle the whole of the issue no matter what age you or your children may be. So straighten up in more ways than one. Until next time.